All right, party people, we are back at it with another question. Let's get it. So, if I was to give you a patient, female, 50s, with a decrease of 15 pounds recently, as well as anemia, for reference, the normal range for hemoglobin is 12 to 17.5. Her leukocytes are normal. She has splenomegaly, as well as a dry tap on bone marrow aspiration. Now, dry tap on bone marrow aspiration is highly indicative of myelofibrosis. Now, what you would see on a blood smear with myelofibrosis is teardrop cells, aka dacrocytes. This is from those cells having to be squeezed out of that fibrosed bone marrow. If I give you the option choices below, that being translocation 922, translocation 1114, JAK2 mutation, translocation 1122, translocation 1517, which one would you choose as the correct option for this constellation of symptoms? Please make your selection. 3, 2, 1. Boom! JAK2 mutation is the correct answer. First and foremost, let's go over JAK2. So, JAK2 mutation is associated with myelofibrosis, essential thrombocythemia, as well as polycythemia vera. Now, even if you're unsure about JAK2, you have to be very familiar with the other mutations to be able to answer questions like this correctly. So let's run through it, starting with translocation 922. aka Philadelphia chromosome. This is associated with CML. This involves the BCR-ABL fusion gene. This encodes for the oncogenic tyrosine kinase. The treatment is imatinib. Side effects are known to be fluid retention or peripheral edema. On smear, you'd see myelocytes, promyelocytes, and metamyelocytes, as well as low ALP. All right, let's cover 1114 translocation. This is classic for mantle cell lymphoma. Quite frankly, that's basically all you really need to know for USMLE. Next up, we have 1122 translocation. This is associated with Ewing sarcoma. This is a pediatric bone tumor. Do not confuse this with 22q11 deletion of DeGeorge syndrome. Ewing sarcoma presents as small blue round cells with onion skinning on histo. The clinical picture may include bone pain, fever, mimicking osteomyelitis. Now, to differentiate between the two, please note that diaphyseal uptake on bone scan is Ewing sarcoma, as opposed to metaphyseal uptake on bone scan is osteomyelitis. All right, now let's do the 1517 translocation. This is associated with AML, acute myelogenous leukemia, specifically the M3 subtype. This is also known as acute promyelocytic leukemia, APL. On smear, you'll see our rods. These are composed of myeloperoxidase. This is a blue-green heme-containing pigment. Remember, the treatment is all-trans retinoic acid, vitamin A, which can cause cell lysis and lead to DIC, disseminated intravascular coagulation. You need to know this. All right, and just to recap, for JAK2, remember myelofibrosis, essential thrombocythemia, as well as polycythemia vera. All right, that's it for this one. Go crush it.